Hello, everyone. You're welcome to Dr. Boom's YouTube channel. Today, we'll be talking about a very interesting and exciting topic. Did you know that 1 in 10 women struggle with a hormonal condition that can cause everything from irregular periods to infertility? And even worse, many women don't even know they have it. Today, we are diving into polycystic ovarian syndrome, or as it's popularly abbreviated as PCOS. Stick around because not only will we uncover what polycystic ovarian syndrome is and why it happens, but also we will be sharing practical steps to manage it and prevent its long-term complications. Let's take control of our health together. So, what is polycystic ovarian syndrome? We need to understand the basics. Polycystic ovarian syndrome is a hormonal imbalance that primarily affects women of reproductive age. But what does that really mean? Let me explain. The ovaries are part of the reproductive system and release an egg each month as part of a healthy menstrual cycle. In women with polycystic ovarian syndrome, this process gets interrupted. Normally, eggs mature inside fluid-filled sacs called follicles, and during ovulation, one egg is released. However, in polycystic ovarian syndrome, these eggs often don't mature properly, and instead of being released, they stay inside the follicles, forming what we call cysts. This disruption leads to irregular periods and can also cause infertility. But here is the thing. Polycystic ovarian syndrome isn't just about missed periods or trouble getting pregnant. It affects your entire body, from your metabolism to your skin and even your mental health. That is why it's so important to recognize this condition early. Polycystic ovarian syndrome, the hidden hormonal imbalance, is a hormonal roller coaster that can turn your reproductive health upside down. Your ovaries are home to your lifetime supply of eggs, tucked up in tiny sacs called follicles, like I already said. Each month, your brain sends out hormones to kickstart the maturing process. But like we earlier said, in women with polycystic ovarian syndrome, something goes wrong. We have to recognize the symptoms of polycystic ovarian syndrome. But first of all, let me explain the etiological cause medically. we will manage to explain it. We hope you will be able to grab it as we proceed. So we are about to talk about the science behind polycystic ovarian syndrome. What actually goes on inside the body when a person has this condition. The hormonal chaos. It all starts with hormones. Hormones are chemical messengers that control everything from your metabolism to your mood. In polycystic ovarian syndrome, the balance of these hormones is disrupted, and it begins with two key hormones: luteinizing hormone and follicle stimulating hormone, FSH. That's the LH and FSH, both produced by the pituitary gland. Normally, these hormones work together to help your ovaries produce estrogen and progesterone, which regulate your menstrual cycle and prepare your body for pregnancy. But in polycystic ovarian syndrome, the pituitary gland releases too much luteinizing hormone, which causes the ovaries to overproduce testosterone. This excess testosterone prevents the follicles in the ovaries from maturing properly, which stops ovulation from happening. At the same time, insulin resistance plays a huge role. Insulin is the hormone that helps your body use sugar from carbohydrates for energy. In women with polycystic ovarian syndrome, the body cells don't respond to insulin the way they should, leading to higher insulin levels. This in turn increases the production of androgens like testosterone, creating a vicious cycle. What are the long-term risks of polycystic ovarian syndrome? But first of all, let's look at some of the symptoms so that we'll be able to recognize the symptoms of polycystic ovarian syndrome, as some females don't know they have this condition. So how do you know if you have polycystic ovarian syndrome? The symptoms can be varied and sometimes confusing. Let's break down the most common ones. The first is irregular periods. This is one of the hallmark signs. If your periods are very spaced out or you're skipping them altogether, it could be a sign that your ovaries aren't releasing eggs regularly. Secondly, unexplained weight gain. Many women with polycystic ovarian syndrome struggle with weight gain, especially around the abdomen. This happens because polycystic ovarian syndrome is closely tied to insulin resistance, which makes it harder for your body to regulate blood sugar and store fat. Excess hair growth, that is hirsutism. If you are noticing more hair growth in areas like your face, your chest, or back, this could be due to higher levels of testosterone. Yes, even women produce small amounts of this male hormone, and in polycystic ovarian syndrome, it can spike. Acne and oily skin. Hormonal imbalances often lead to breakouts, particularly around the jawline or lower face. Thinning hair on the scalp. While you may notice excess hair in some places, you might also experience hair thinning or loss in your on your head, which can be a frustrating symptom. Difficulty getting pregnant. Because ovulation doesn't occur regularly in women with polycystic ovarian syndrome, it can be difficult to conceive without treatment. If you are experiencing any of these symptoms, it's a good idea to talk to your doctor and explore whether polycystic ovarian syndrome could be the cause. The long-term risks of polycystic ovarian syndrome. Polycystic ovarian syndrome isn't just a condition that affects your reproductive system. If left unmanaged, it can have serious long-term health consequences. Here are a few things to keep in mind. Type 2 diabetes. Because polycystic ovarian syndrome is linked to insulin resistance, women with polycystic ovarian syndrome are at a much higher risk of developing diabetes later in life. Heart disease, elevated cholesterol levels, high blood pressure, and obesity, all common in women with polycystic ovarian syndrome, can increase your risk of heart. Polycystic ovarian syndrome can increase your risk of heart disease. Endometrial cancer. Since women with polycystic ovarian syndrome often experience infrequent periods, the lining of the uterus can build up, increasing the risk of cancer. Mental health. Anxiety, depression, and low self-esteem are also common in women with polycystic ovarian syndrome, particularly due to the physical symptoms and challenges with fertility. It's clear that managing polycystic ovarian syndrome isn't just about controlling symptoms, it is about protecting your long-term health. So now we move over to managing polycystic ovarian syndrome with lifestyle changes. While there is no cure for polycystic ovarian syndrome permanently, there are plenty of ways to manage it and reduce your risk of its complications. The key lies in lifestyle changes. 1. Balanced diet. Focus on whole foods that are low in sugar and refined carbs. A diet rich in whole grain, lean proteins, vegetables, and healthy fats can help regulate insulin level. Try to avoid processed food and sugary snacks that can cause blood sugar spikes. Exercise. Regular physical activity can significantly improve insulin sensitivity. You don't have to hit the gym hard. Even moderate activities like walking, cycling, or yoga can make a big difference. Aim for at least 30 minutes a day, most days of the week. Weight management. If you are overweight, losing even a small amount of weight, around 5 to 10% of your body weight, can help restore ovulation and regulate your periods. Reduce stress. Stress can make symptoms of polycystic ovarian syndrome worse by increasing cortisol levels. Find ways to relax, whether it is through meditation, deep breathing, or simply spending time on things you enjoy. Sleep Prioritize getting at least 7 to 8 hours of quality sleep each night. Poor sleep can disrupt hormone regulation and worsen polycystic ovarian syndrome symptoms. We move over to medical treatment for polycystic ovarian syndrome. The use of. So in addition to lifestyle changes, there are several medical treatments that can help manage polycystic ovarian syndrome. Here are a few options your doctor may suggest. The first is hormonal birth control. The pill can help regulate your menstrual cycle and lower testosterone levels, which can reduce symptoms like acne and excess hair growth. Metformin. So before we go ahead, there are various hormonal birth controls, but it is best you visit your doctor so that the best can be prescribed for you. Metformin. This medication is commonly prescribed to manage insulin resistance and lower blood sugar levels. It can also help restore regular periods and improve fertility. Fertility treatment. If you are trying to conceive, fertility medications like clomiphene citrate can stimulate ovulation. For more severe cases, in vitro fertilization may be an option. Ovarian drilling. This surgical procedure is sometimes recommended for women who haven't responded to fertility medications. It involves making tiny punctures in the ovaries to help lower testosterone levels and stimulate ovulation. We move over to preventing polycystic ovarian syndrome complications. Why polycystic ovarian syndrome can't be fully prevented? You can lower your risk of complications by making a few key lifestyle adjustments. 1. Maintain a healthy weight. As mentioned earlier, weight management is crucial. Keeping your weight within a healthy range can help regulate hormones and reduce insulin resistance. 2. Monitor your blood sugar. If you are at risk of diabetes, regularly monitor your blood sugar levels and consult your doctor to keep everything in check. 3. Stay active. Regular exercise isn't just good for weight management. It's essential for overall hormone balance. So we have to exercise regularly. We have to eat healthy as well. We also have to get regular checkups. Regular health checkups and screenings can help you catch any complications early before they become serious. We move over to final thoughts and call to action. Polycystic ovarian syndrome may feel overwhelming, but remember, you have the power to manage your symptoms and take control of your health. Through lifestyle changes and the right treatments, you can improve your quality of life. If you found this video helpful, be sure to hit the like button, share it with your friends and family, and subscribe for more valuable health tips. Let's spread awareness and help more women take charge of their polycystic ovarian syndrome journey. Please drop a comment below if you have any questions or want to share your personal experience with polycystic ovarian syndrome with us. Thank you for watching, and please take care of your health. Have a great day.